Most of them, it was discovery. They just jumped right into the first thing they said and they didn't find out, oh, this patient actually had $4,000 she was willing to spend. And all you did was offer them Botox, right? That was it. We've done like personality quizzes as well for the team because I wanted to understand them as well and their sales approach. And there are some that are just better, right? They're more like a chameleon. They can match, they can read the room and they can do that. Where others are more analytical and they start analyzing things. I'm like, get out of your own head, stop it, right?
Yeah.
Some are more direct and they just blow past everything and they don't listen to the emotional.
So what are you doing right now with your team to strengthen the consultation approach?
So initially it was actually seeing where each of them was. I had to go and spend time with each of them because I didn't know what I didn't know yet. And so it was just going in and spending time with them while they were in the treatment room with their patients. We have our consult form. We have all those things that are already available to them. And it's like, okay, well, are they using it? No. Why? Right? And it's diving in. In the consult itself, it's looking at and saying, okay, they're good at that initial introduction, credentialing themselves. They do that. And then the patient would tell them, okay, well, this is what I want. And they would jump right into, okay, this is your solution. Instead of that discovery phase, they needed more time in that discovery phase. They needed to be able to dive in and say, why do you care about this? And what does it mean to you? And what is your timeline? Who, what, where, when, why? Let's ask all those questions. And then educating to be able to say, okay, this is what you're telling me. This is the reason for it. Now we're going to get into the solution. This is how I'm going to solve your problem that you cannot solve yourself, right? A patient comes in, they have a fundamental concern that they cannot address themselves. And so they're coming to you as the expert to be able to say, what is it that I need to do to be able to address this concern? Then you come up with your plan, present it, work through any questions, any concerns that they have, and then close it, right? It has to be a systematic thing. Otherwise, if you miss any of those points, it comes across as sales, because they are being told they need something that they don't understand how it relates to their concern. Or the close doesn't happen. It's, well, let me know what you think. Well, get back to me. And you're putting it in their place instead of, okay, these are the 2 dates I have open. What would you like? It's really the whole system. But initially I had to go in and just find out where was each of their gaps. And each of them was slightly different. Most of them, it was discovery. They just jumped right into the first thing they said and they didn't find out, oh, this patient actually had $4,000 she was willing to spend. And all you did was offer them Botox, right? That was it. And you didn't address their whole concern. And so that was the first part of it. And then once I found out where their gap was, we worked on that individual part of the consult with each of them. So it's understanding yourself, what an excellent consult should look like, and then being able to identify where their gaps are within that process and then be able to work through. And when we work through, it's a variety of things. It's one, just recognizing it. Two, practicing, which is the awkwardest thing ever, right?
Oh, yeah.
It's like you're saying this out loud to me and you're going to do it over and over and over. And while it's so awkward, it's so helpful because if you can't speak it, then when you're in the room with a patient, it's going to come across as awkward too. So get that awkwardness all done on your own. Go talk to yourself in the mirror, talk to your kids, do a consult on your kids, whatever it is that you need to do. But it's practice. I don't think that confidence is necessarily a character. I think some people are more naturally confident and able to express that, but I don't necessarily think it's a character trait so much as a practice and awareness. It's being aware of where you are. You first have to have that, and then understanding what does excellent look like, and then working towards that. And I really do believe it can be learned. It's just time and effort.
Yeah, comes with practice and consistency, discipline. I totally agree. I don't think it's a character. I think some people are naturally better at communicating.
Yeah,
maybe
absolutely.
That's like an enhanced characteristic of.
I think it's more personality. If you look at, we've done like personality quizzes as well for the team because I wanted to understand them as well and their sales approach. And there are some that are just better, right? They're more like a chameleon. They can match, they can read the room and they can do that. Where others are more analytical and they start analyzing things. I'm like, get out of your own head, stop it, right?
Yeah.
Some are more direct and they just blow past everything and they don't listen to the emotional. And so it's like, understand yourself so that way then you can understand others. But yes, I agree.
Yeah.